What we gotta do?
Legalize.
Yeah, what we gotta do?
Legalize.
Yeah, what we gotta do?
Legalize.
Gotta put them bushes right in the grave.
We're working in the Senate. We have Senators Kennedy and Kerry have agreed to write a letter to the DEA, and we're now going to be engaged in the next 3-4 months in a process to lobby various senators to see if we can generate pressure from the Senate down onto the DEA. Now, actually what my expectations are that the Bush administration is incapable of reversing itself, of admitting mistake, of being compassionate, is just holding on to this hard line of they won't permit research. And so chances are there'll be no progress until November 2008. And what we're trying to do, though, is act in good faith, try to generate pressure. And one purpose is to try maybe to get the Bush administration to change its mind, but the other purpose is to give courage to the Democrats if they happen to get elected in 2008, if they are putting themselves on the record now that they're in favor of medical marijuana research, then hopefully whoever the Democratic president happens to be, if there is a Democratic president, will not feel like they need to shy away from this issue, that they'll be able to take a principled position and support science over medicine. That's our sincere hope. Meanwhile, in Israel, where we're working on an MDMA post-traumatic stress disorder study, we're working with the Ministry of Health to create what may become an international model. The ministry there has been compassionate, been sympathetic, and has approved about 160 or so patients on recommendations of their doctors for legal access to medical marijuana. These patients are mostly AIDS patients, cancer patients, MS patients, chronic pain patients, and the ministry did not want these people to have to go to the black market to get their marijuana. So they gave a license to a fellow, Tzachi Cohen, to grow marijuana for provision to the Ministry of Health approved patients, but he was only permitted to give it away. He's done that for a while now, several years, on a compassionate basis. The program is going to be growing with more patients. The ministry recognizes this is not a long-term sustainable situation, so they're now pondering whether to give a license for Tzachi to grow for sale. They've asked MAPS to be involved because we are so involved in FDA-approved research in various dimensions in Israel with MDMA PTSD and in the US and in other countries. So we then brought Philippe Lucas, who is the director of the Vancouver Island Compassion Society, an expert both in the production of medical marijuana and in regulatory schemes for how it should be developed and distributed. He's also involved in a lawsuit against Health Canada for their medical marijuana program, production program, which he thinks is inadequate. We met with the Ministry of Health and we presented them with this concept that marijuana, it's not really approved by the Ministry of Health or by the FDA for prescription use. The most appropriate way would be to permit production for sale, but only within a nonprofit context. And the Ministry of Health has endorsed that idea, likes that idea. We're forming a new nonprofit. The ministry has actually asked to have a representative on the board of directors, and we're waiting for that approval. David Bronner of the Dr. Bronner Soaps has been a major funder of this effort in Israel and has permitted us to bring Philippe Lucas there, and we're hoping that we'll be able to create this model where compassionate access to marijuana at below market prices within a nonprofit context will be a temporary measure. The permanent measure is to get marijuana approved as a medicine, as a prescription medicine, and then have it be provided in Israel, since it's a national healthcare system, to be provided and paid for by the Ministry of Health. They'll end up saving a large amount of money once marijuana is a medicine, because a lot of the pharmaceutical products are more expensive, don't work as well, have greater side effects, and the marijuana plant produced under legal circumstances is not an expensive medicine, and it has a lot of wide-ranging potential uses. So we're thinking that in the long run, the introduction of plant marijuana, either smoked or vaporized. Vaporized is probably the way that it'll make it through the FDA initially, but the latest research by NIDA-funded scientist Dr. Donald Tashkin shows that marijuana does not cause lung cancer. So when you look at a risk-benefit calculation for the use of marijuana as a medicine, clearly it seems that high-potency marijuana vaporized for certain well-studied conditions can make it. Now the problem here is that the government's war on drugs is based on fear, is based on propaganda, is based on miseducation and misinformation, and that's why there's such a resistance to the research. So even though MAPS is a nonprofit 501c3, we're not lobbying to change laws, we do feel that the research that we're generating will play a larger role in the drug policy debates because we will introduce what we expect to be credible, believable, balanced information about risks and benefits of marijuana and psychedelics. And we're engaged in that conversation, which is a public education effort, and we're hoping that the DEA, the Drug Czar's office, various people will eventually come to their senses and realize that it's in everybody's best interests for the medical use of these drugs to be evaluated scientifically, for the political suppression of science to stop. That's sort of a hallmark of the Bush administration, the political suppression of science in multiple different areas, and for there to be a recognition that the therapeutic uses of these drugs are not just for, quote, hippies who want to get high, but they're for the DEA's own family members who come down with cancer. They're for the Drug Czar's own family members or their own staff or themselves who eventually may need it, and that they're really hurting themselves and hurting everybody else by sticking to this policy of trying to protect the propaganda of the war on drugs by blocking legitimate science.
What we gotta do?
Legalize.
Yeah, what we gotta do?
Legalize.
Oh, what we gotta do?
Legalize.
Gotta put them pushes right in the grave.